Hello guys, hope you're all okay. You're all enjoying your life. You're all enjoying watching my videos and also enjoying practicing radiology and ultrasound. I have uploaded quite a few videos regarding ultrasound imaging, regarding bone pathologies and CT scan imaging, and still I'm in the process. Today I'm going to talk about the available different modalities of the radiology for the diagnostic purpose. If you are a clinician, so this video would be particularly for you, that it will help you out that if you wanted to diagnose the patient, which modality will be the helpful. If you are radiology resident, so still this video will be useful for you. Normally, we know that there are ultrasound imaging, CT scan, MRI, contrast, non-contrast, angiography, barium studies, scintigraphies, and a lot more. But what particular investigation, or I would say, what is the investigation of choice for particular diseases like in the chest or in the abdomen, or if you wanted to do the tumor analysis, if you wanted to look for the bone metastasis, so you should know which is the perfect modality, which is the investigation of choice. So in this video I'm gonna give you the list of the available investigation in the radiology department, and beside this I will narrate on every single investigation that this is useful for certain abnormalities. So at the end of the day, I'm sure this video will help you out. So let's watch this video. Here is the list for the different radiological investigations. It's just the list. So on the top, ultrasound is listed, CT scan, contrast and non-contrast. You can also have the MRI, plain and MRI with gadolinium contrast, or some other contrasts are also available. You can do MR angiography. HRCT is one of the best investigation of choice for the chest. MCUG, barium studies, multiple barium studies are available. Endoscopy or gastroscopy, FNAC to have the histopathological evidence for multiple diagnosis. Echocardiography, bone scans, DEXA scans. So the list is not exhausting, but I will narrate every single radiological modality at length, and I will also mention that in which particular cases it is important, or it will be labeled as an investigation of choice. So let's see. Ultrasonography. Ultrasound is the baseline modality, whether you're working in emergency or in medical ward or in gynae ward or in surgical department. So it is the first important and the baseline modality. But for certain purpose, this ultrasound would be considered as an investigation of choice, like during the obstetric examination. For the obstetric diagnostic procedures, you should depend upon the ultrasonography, because ultrasound is one of the reliable method and investigation of choice for the obstetrics. As far as the gallstones are concerned, CT scan will not be the helpful, MRI will not be the helpful. The one investigation which will help you out would be ultrasonography. If there is ascites, or if there is pleural effusion, or if there is pericardial effusion even, so you can still trust on the ultrasonography. Ultrasonography actually it's important, and it is baseline because of the fact is it will pick certain abnormalities and it will help you to further work on it. So that's why its importance cannot be neglected, because being a baseline investigation, you should have to depend on the ultrasound. But as far as investigation of choice is concerned, you can rely on during the obstetric diagnostic procedures, or gallstones, or if there is any fluid suspected, so you should opt the ultrasonography. Next comes non-contrast CT images. At the expense of radiation, still it is a very important investigation, and it is baseline investigation as well. Whenever there is need of finding the bone fractures, non-contrast CT is the investigation of choice. Beside this, if there is any stone, for example renal stone, so the CT scan is the best modality or investigation of choice, but not in gallstone. For the gallstone, you have to depend on the ultrasonography. If there is air suspected somewhere within the tissues or post-operative, so CT non-contrast would be the option. Beside this, in acute bleeding, in subarachnoid hemorrhage diagnosis, non-contrast CT scan would be the investigation of choice. If there is any congenital anomalies with the bone, like in the bone congenital abnormalities, non-contrast CT scan would be helpful. If you suspect somewhere calcification within the tissues or somewhere within the organ, or for example in the brain parenchyma, you have to depend on the non-contrast CT images. Contrast enhanced CT, when you inject contrast agent to localize the pathology during the CT scan processes, this is called as contrast enhanced CT. Contrast enhanced CT is used for the detection of the chest pathologies, but not for the Pancoast tumor. Pancoast tumor can be detected on the MRI images. If there is a pathology you need it to be detected for the mediastinal, anterior mediastinum and the middle mediastinum, you still use contrast enhanced CT images, but not for the posterior mediastinal masses like neuroenteric cyst or neuroenteric tumor. For that you need to have the MRI. MRI is the investigation of choice for the posterior mediastinal masses. Acute necrotizing pancreatitis can only be detected on the contrast enhanced CT images. If there is blunt trauma, so for the blunt trauma and you suspect any bleeding, you need to have contrast enhanced CT images. There are, if for example you suspect any nasopharyngeal angiofibroma, so contrast enhanced CT scan would be helpful. Beside this, if there is renal tuberculosis, so renal tuberculosis in the late stages, you can use the contrast enhanced CT images. In earlier stage, renal TB can be detected on the IVP. Beside this, if there is diverticulitis, so for the diverticulitis purpose, you also have to have the contrast enhanced CT images. So these are lists which has been given to you here. You can see on this line all these diagnoses can be made on the contrast enhanced CT images. MRI. MRI is investigation of choice for certain pathologies, like if there is suspected spine pathologies including spinal metastasis, so MRI is one of the choice investigation. If there is avascular necrosis, which is very common in the scaphoid or lunate, especially carpal bone avascular necrosis, or femoral head avascular necrosis, so MRI should be considered. Beside this, if there is a suspicion of the posterior mediastinal masses like neuroenteric cyst or neuroenteric tumor, so MRI should be considered for that. Beside this, there are certain other abnormalities like subarachnoid hemorrhage, 4-vessel angioetiology should be, for the diagnosis of this 4-vessel etiology, MRI should be considered. For the posterior fossa, MRI is a standard investigation of choice. If there is any intracranial space occupying lesion, so still MRI is the investigation of choice. So the list which has been given here, all this list, if you wanted to diagnose this and if you wanted to confirm these pathologies, you have to have the MRI scan for that purpose. Very important radiology investigation is HRCT. HRCT specially used in the chest department for the detection of the chest abnormalities. So for the chest detection, you have to have the HRCT, and especially if you suspect bronchiectasis HRCT would be the investigation of choice. If there is any solitary pulmonary nodule, so the HRCT is one of the basic investigation of choice. You all know that solitary pulmonary nodule has a wide variety of differential diagnosis, ranging from the granuloma and the metastasis and carcinoma and granulomas and certain other cancerous and non-cancerous entities. So to detection of the solitary pulmonary nodule, you have to have the HRCT for the diagnostic purpose. If there is interstitial lungs disease, interstitial lung disease are quite a few. So if you need to distinguish between, so you have to have the HRCT. Sarcoidosis is the disease which can only be confirmed on the HRCT. In case of temporal bone pathologies, whether it is mastoiditis or otitis media or temporal bone abnormalities, including like tympanic membrane rupture, so all these can be confirmed on the HRCT. Next comes MCUG. MCUG is micturating cystourethropy. As the name shows, it involves the urinary bladder, it involves the urethra. So if you do suspect any of the abnormality with the posterior urethral valve, you should have to depend on the MCUG. It is basically used in pediatric setting, and if there is any posterior urethral valve, which happens to be most common in the boys, in the men, so you should go for the MCUG. If there is any vesico-ureteric reflux, so this leads to an abnormal state in the later life, but starts from the pediatric group, especially in the children, or especially those having any abnormal tunneling of the lower urethra, lower ureter. So these are investigation of choice to confirm the vesico-ureteric reflux. And as far as the vesico-ureteric reflux gradings are concerned, grade 1, 2, 3, 4, 5, all these can be confirmed on the MCUG. So MCUG is investigation of the choice for the posterior urethral wall detection and for the vesico-ureteric reflux. Bone scan. Bone scan is very vital investigation, and it is used for when there is suspicion of the bone metastasis. So bone metastasis can only be seen on the bone scan. It is very important investigation. There are certain abnormalities like certain carcinomas which causes metastasis particularly to the bone, and as a result we need to know that where actually which bone is involved and to what extent this metastasis is gone. So therefore the bone scan is one of the very important investigation. Beside this, there is another scan which is called as DEXA scan. DEXA scan is used for the detection of the osteoporosis, if there is any osteoporosis, or if there is need of to know about the bone density. So for the detection of the bone density and osteoporosis, the DEXA scan can be used. Of course, barium studies cannot be ignored, because barium investigations are the important and integral part of the radiology department. When there is suspicion of any esophageal abnormalities, we use the barium swallow. Barium swallow can be used to detect the achalasia cardia, very common, and it also used to confirm certain tumors within the esophagus. Beside this, barium meal and barium meal follow through can be used to detect any abnormalities in the stomach area, any tumoral abnormality. Especially it is also useful method to detect the hyperpyloric stenosis in the children. So this is also used for that purpose. As far as barium anemia is concerned, if there is any polyps or any tumors within the sigmoid colon or rectal area, or sometime you need to look for the changes of the ulcerative colitis or Crohn colitis or Crohn disease changes, you can depend on the barium anemia. So barium studies are one of the integral investigations of the radiology department. Gastroscopy and endoscopy, these two are very important investigation. If there is any pathology related to GI tract, so you can depend on the gastroscopy and endoscopy to detect any of the polyp or any lesion or mucosal erosion or any tumor. If there is any suspicion for the Crohn's colitis or Crohn disease, if there is any suspicion for the ulcerative colitis or ulcerative changes, so you can use the endoscopy and gastroscopy for that purpose. Scintigraphy, or in other words we can call as radionuclide imaging. Nuclear medicine is one of the branch of the diagnostic radiology in which we use the radioisotopes to detect the pathologies and to differentiate between hot and cold nodules and to look for to what extent this disease has been progressed. In different sectors, for example, if you need to know about the thyroid or goiters or Hashimoto goiters or Hashimoto thyroiditis or different type of multinodular goiter or colloid abnormalities of the thyroid, you need to have the scintigraphy beside FNAC. And if there is any abnormality with the kidneys, so in the renal, like if the renal function, you have to assess that, so DTPA, DMSA. And if you know, if you wanted to know any congenital abnormalities related to renal, so whether there is a small tissue somewhere or there is any absence of the kidney, so you wanted to know where the kidney is location or any ectopic renal tissues are there, so you can use these DTPA and DMSA scan. As far as cardiac imaging is concerned, MEB scan can also be used. For the bone, as I have already discussed, the bone scan to detect the metastasis. So in short, this scintigraphy or the nuclear medicine is one of the integral part of the diagnostic radiology, and you can depend on for the detection of all these points which I have already mentioned.